Good evening, everyone, and Happy New Year. Welcome to our webinar today. We are going to give our participants 3 more minutes so that they can check in. So karibuni sana. So I think we'll begin. So welcome to our participants. We are saying a big welcome to you. A big welcome, of course, to our panelists and presenters. Happy New Year to you all. We hope for a better 2021. Our topic for today is focusing on the future with hope. So before we continue, we would like to recognize the presence of some of our panelists today. We would like to invite Jacqueline Anundo, a member of CPAK, to say hi to us as we continue. Karibu sana, Jacqueline.
Thank you very much, Dr. Ohas. Happy New Year to everyone. Indeed, it's a pleasure once again to continue with these webinars, and you're looking forward to a better 2021 and more learning. Thank you very much.
Asante sana, Jacqueline. We are going to next welcome the KMA Secretary, Dr. Simon Kigundu, to say hi to us as well. Karibu, Doc.
Happy New Year, Happy New Year. And we want to thank all of you for bringing hope in the new year, despite all the COVID. And I hope we will have a good start to the year with a fantastic topic that we have lined up. Thank you very much.
Thank you so much, Daktari. We will welcome our Vice President, Dr. Amos Otara, to say hi to us. Karibu, Doc.
Hello, good evening and Happy New Year to everybody. And I take this opportunity also to welcome everybody to this webinar. I hope you have had a nice break over Christmas with your families. And as the topic rightly says, we are looking to the future with a lot of hope. So let's hope this year will be better than the past year, and welcome to the presentations.
Thank you so much, Daktari. So without further ado, we will dive into our topic for the day, which is focusing on the future with hope. We have three very able presenters with us. This will be an interesting topic, and it should also be an interesting way in which it will be delivered, because we have three presenters. Of course, we have with us Dr. Liz Haemba, who is the chair of CPAK. We have with us Dr. Edith Koba, who is a consultant psychiatrist. And then we have with us Cecilia Ndungu, who is a registered BSN nurse. So karibu sana to our presenters. I know you've been seeing them, they're not new to us. So we will start with Dr. Liz Haemba. 2020 was a very hard year for all of us, or maybe let's say a challenging year. So tell us about that, Karibu.
Asante sana, and Happy New Year to everybody. It is nice to be back and nice to have this weekly webinars once again this year. And I think, yes, we will indeed dive right in. What happened in 2021 and 2020? We had several things happen to us that have never happened before. Globally, everybody was just trying to stay alive. At least the majority of the people were just trying to stay alive. For once, we were made very conscious of our how fickle and how delicate our life is, or our lives are, and we really had to work hard to be alive and be present and be there for everybody despite what we went through. So in Kenya, what happened, or at least in East Africa, I can only think of one other major event that happened in 2020. Maybe somebody else will remind me at some point. But we first started by having the Locust Plague, which had actually been going on from 2019 at some point. And this continued, and we had lots of losses, and this went and spread throughout East Africa. In the wider area, globally, we had, of course, the fires, that a lot of climate change issues. There were fires in Australia. There were numerous, more than usual hurricanes in the US. And there was the racism in the US, which is comparable, would be comparable to our own tribal issues here in our country. This came as a surprise to many of us. And I mean, we were glued to our screens for a while. And this happened actually during COVID. And COVID was the main thing that occurred during this 2020. That's what 2020 and 2021 and going forward, I think that's what we'll remember these years for. And as I said before, we all just tried to live. We all just really, really worked hard to stay alive. What other changes basically did we see? We became very friendly with technology. which came to the forefront, especially for some of us who had been really trying to avoid using too much technology. It became very important because this is how we kept in touch with our families. This is what our children started using for learning. This is how we actually went to the workplace and worked. And many, many things actually were used, we used technology for. But some of the more really serious consequences of COVID were loss. We had a lot of loss. And I remember in one of the webinars last year, we actually talked about grief and loss around life as it used to be, and that's a really big thing because COVID destabilized us quite a bit, and a lot of us did not know what to do. I'm sure you remember, I remember my days where I had a lot of insomnia. Because I'm an introvert, I initially said, oh, this is going to be a wonderful time. As I stay home, I'm going to read, catch up with my the course that I was taking at the time, and just do the things that I was unable to do when I had to go to my clinic and see patients. And I could not read. I could not do my course. I'm still actually had to have an extension of my course because of just how much COVID destabilized me personally, emotionally. And it was not just me. As someone who works with children, with adolescents, with young people, there was quite a bit of work to be done in that front. A lot of family issues came up. A lot of issues with adolescents came up. A lot of suddenly there was a big influx of sexuality issues, where people are trying, at least these young people are trying to find themselves. Other than that, businesses shut down. And this, of course, led to loss, and many, many jobs were lost in this space. We saw a lot of relocation, people leaving the city to go back to the village because they just could no longer afford to live in the city. Some of the businesses that were shut down to date are not open and may actually not reopen. We also found that people got ill, including us as a medical fraternity. People got ill, people fell ill, and people died. And there was loss, and there was fear, and there was heartbreak, and there has been and still continues to be a lot of loss. And some people who got ill and recovered are still struggling. They're still recovering. They're still lost a lot of things that they could do before. Some have had serious cognitive losses. Some have had physiological losses, and they're still really just struggling to recover and get better. A lot of us lost close people, family. We lost colleagues, and the more we lost colleagues, the more fearful we became. And we've had webinars where we try to really encourage and motivate each other. And that works, that helps. At least I know it helps me quite a bit to know that I have people who around me who we are going through the same thing and we are working together. Dealing with grief became also something that a lot of us are doing on a day-to-day basis. And that can be hard. Yeah, that can be difficult. So working from home for a lot of people was quite new. And as a mental health specialist, we found lots and lots of issues came from that. Apart from, of course, the positive effects of families getting closer together, there were also issues, some negative issues where we experienced cases of gender-based violence. There were difficulties with parents and children, sometimes coming together with children who you actually barely know. They're your children, but you actually barely know them, and getting to know them sometimes proved to be difficult for the children and the parents. Yeah. And then we also saw these young people having a lot of issues, running away from home. We remember those cases where we had young girls and young boys running away and going and doing totally different things than we expected from our children. So there was that. Children had difficulty adjusting. They had difficulty not being with their peers. They had difficulty, of course, during the lockdowns. And just even working with the rules and the rules around masking and sanitizing that had been put in place, that was also quite difficult for most of the young people. One of the other issues that I think we had as people in the medical field was burnout. A lot of us are still suffering from that. And burnout really is common for all professions. But during the pandemic, medical workers' burnout has been so great. Yeah, there's been a rising rate of burnout, which has affected both patients and the medical specialists working with them. Yeah, so and for like even the young medical practitioners, the young doctors, burnout actually we know starts right from med school and then of course continues. And with our newly graduated medical specialists who are now working and were at the forefront in the COVID, during this period of COVID, it has been very, very bad. It has been a bad experience for them, yeah. So there's a reason for concern here, and there is need for intervention for clinicians, for other employees, of course, and for parents who have really had to work hard on parenting while at the same time continuing to do their jobs, yeah. So that has been difficult. We have had a lot of barriers to self-care during this time, where we are actually really needed at the forefront. And sometimes it is difficult to actually put in place strategies to care for yourself when the need is so great, yeah. So this is something that I think maybe Dr. Koba will address during the next bit of this presentation. And then, of course, there were issues around stigma. I'm sure all of you remember those very first days when, if you're a medical specialist and you have even neighbors, you live maybe on an apartment or something, and there was a lot of stigma. There was stigma from family. There was stigma from basically anybody that you were around. And I mean, we felt very disempowered and really unhappy because we did not know how to cope with this thing. And this, to an extent, continues still. Yeah. And so another of the consequences of COVID, or this period that we are still going through, is mental distress or mental illness. I know it is difficult when we speak about mental illness, or because we would really like someone to give us a diagnosis. Like you either have depression, you have anxiety, or you have whatever mental illness. But some of these mental issues are not really mental illness that is diagnosed yet, or that has been diagnosed. And we can call, that's why I call it mental distress. Yeah. So we've seen a substantial increase in mental distress with people presenting with symptoms of depression, yeah, grief, grief that is not resolving or is unresolved, with a lot of fear around maybe where you work. And this may not meet full criteria for diagnosis of a mental disorder, but definitely we know that there are some issues here that need to be addressed. A result of these mental distress has been issues like substance abuse, gender-based abuse, you know, or interpartner abuse, and many other issues that are kind of new or that have come up due to the stress that healthcare practitioners are going through. So we have seen these issues, and we know that we really still do need to support each other and get support even from other areas if we can, yeah, because of the emotional suffering that COVID has brought about with it, yeah. So on the positive side, even as we talk about the emotional suffering, we've seen advances in telepsychiatry or telepsychology, where we've been able to reach our people in the medical field through our telephones. Our call center is one of these, and we'll talk about it at some point. Yeah, and this, even within the mental health field, has been used to replace a lot of one-on-one or in-person visits, mostly due to, of course, social distancing and safety reasons. Yeah. So as I talk of this, I'm sure I've said a lot of things in the past because we were trying to rehash what happened in 2020, but we do recognize and realize that COVID is still with us. We know right now that Europe is actually in total lockdown because they had a surge, and we don't know what will happen. We don't know what will happen to us. We pray, of course, for the best, but history has shown that we've had the first of COVID, and we had then the second phase of COVID, and we don't know. So we still have to take all these measures into place. We still have to put all measures into place. We still have to continue sanitizing and washing hands and just really being careful. But we may also now, as we are talking about hope for 2021, we also need to find out what can we do to give ourselves hope, to ensure that this year is not as fearful, is not as traumatic, is not as stressful as last year was. What have we learned in 2020 that can help us to deal with anxiety and the stress that 2020 brought forth? And with this, I think I will hand over to Dr. Koba, who will then take over and try and address these issues. Dr. Karibu.
Thank you very much, Liz, for taking us through that reflection about what 2020 meant. And I'm sure many of us identify with the various aspects of what really that looked like. And as we sit here, 2021 January, I know many of us may have asked ourselves, do we even need, given what happened to 2020, do we even need to have resolutions? What are we looking at? Are we sure that it won't be worse than it was? Of course, we are not. But the one thing that we want to encourage ourselves to do this evening is to remain hopeful, because otherwise we die. We die, whether it's physically or emotionally. And really, it's important that as long as we live, we really live. We are not walking dead. And that's the point of this discussion. And I'll just start by asking ourselves, what really is hope? I know we've talked about hope, remain hopeful, but I'm sure many of us have not taken time to ask ourselves, what is that hope we are talking about? And if you look at a lot of definitions, then you will see it's like expectation that there'll be a positive outcome. There are many negative outcomes, as Liz has told us, in 2020 as it was. But we are glad that we are here, and we want to hope that we will also see the end of 2021 even better people. And I'm glad that she was able to highlight that despite all the challenges, we were able to learn a few things. And that's what hope is about. And hope is looking at the glass as half full. There are many things we lost. People lost jobs. People lost their health. People lost their friends. But we are here. We are alive. And we are grateful for that. And we want to look at the fact that we've been given another chance, another year to live, and we want to live fully. So hope is saying that despite all the darkness, there's still light, and we can live and we can enjoy without being afraid that many negative things will happen. And that's what we want to encourage ourselves to do this new year. How do we begin to do that? And the first thing I want to say that when you remain hopeless, it affects you. It affects your physical health. It affects your emotional health. It affects your ability to relate with people. It affects your productivity. So there are a lot of negative things that come with hopelessness. And that's what I was alluding to. You can be alive, but you're walking dead, because then you don't see a tomorrow. So we want to be a community of healthcare workers who are saying, despite all this darkness, there's light at the end of the tunnel. And that will come from within us as individuals and as a team. And that's what we want to encourage ourselves to be able to have within ourselves. And how do we do that? And thinking about what Liz has told us, the first most important thing is a heart of gratitude. Stuff happened to all of us. I don't think anyone was left unscarred in some way or the other. If you didn't lose a loved one, you lost finances, you lost to some extent, you lost peace for the nights that you didn't sleep. However, despite all that, there's something that you could count as a blessing. And to some, it's even just having your spouse or your children at home for a long time. There are some of us who have always been apart from our very close loved ones because of work. Then COVID-19 happened, and you're able to spend some good amount of time and learn a few things about them, whether it's about children, about your spouse, and that's something positive to think about. So a heart of gratitude is the first way of remaining hopeful within yourself that it didn't all go down despite the job losses, despite the school lost years in terms of school fees. There are positive things that happen, even if it's learning how to bake because you had all the time. A heart of gratitude, that's where we start as we start 2021. The next other important thing is to encourage ourselves to learn to think positively. One of the things that happens when you go through a lot of difficult times is that unfortunately you tend to think about everything you lost and you never learn how to pick the positive things, and that makes you get feelings or thoughts like I'm useless, I'm a failure, I am doomed. Is it true? Is it a fact that you're doomed just because your spouse lost a job, or your child was not able to progress to the next grade and you have to look for school fees you didn't plan for, or your business collapsed? Is it a fact that you're doomed? Is it a fact that there will never be, business will never work again, for example? And I know many of us who had small businesses, some businesses have had to close, small and big. The one important thing that we need to do going forward is to keep reminding ourselves that the way we think affects how we feel, affects how we behave. And we need to foster a positive way of thinking that despite the losses, despite the fact that the matatu business, I had to sell the matatu that I had taken on loan because they were carrying now 10 people and I couldn't make any other profit. I learned how to put up some chicken to supplement my business. That's something I had never thought about. Positive thinking, it's very, very important. The other important point that we want to consider as we think about the future is looking at the bigger picture. So there are many small things. You probably, like I was saying, you probably had to spend a lot of time with your children, different from what you really hoped for. And you spend a lot of money buying food because at times they are in school, or whatever it is that you had to, the adjustments you had to make because they were at home. But what's the bigger picture? Your relationship is probably made for good, I hope. I hope that's what happened to many of us. And it of course, we recognize that for some people, it could be that the relationship didn't go very well, but there must be something that is bigger than the small things that happened because of the small things that happened during 2020. So looking at the bigger picture and saying, despite the fact that I had to spend more on food, or I had to work from home, I learned how to use Zoom, for example. Many of us have suddenly discovered that they can do so many things online. So looking at the bigger picture and the gains that you get instead of looking at the small fights you had with the children at home, very, very important. The other important thing to keep doing as we move on in 2021 is celebrating successes. Other than the failures that happened in 2020, other than all the negative things, is there something that was successful? It could be an online course that you had always wanted to complete and you never had time, and you are looking only at the negative things. Did you pat yourself on the back that despite having to create time for your children, create time for your spouse, work online, and sometimes that online meant that you work a little more, is there anything that you achieved in the previous year, small or big? Whatever it is, we need to learn to pat ourselves on the back and say, you're doing well despite all the challenges. So celebrating your own success is one way of remaining very, very hopeful. The other important point that I think would help us to remain hopeful as we focus in the future is being patient. One of the things is it took a whole year to mess your business. It took a whole year to mess your relationship with that's what happened. And we are saying we are not dying, we are living. It's going to take some time. So don't expect quick fixes in the year, because then what happens if you are thinking that there'll be quick fixes and they don't happen, then you become more hopeless and you become more frustrated. We want to encourage ourselves to say, okay, it took years to make, it took a whole year also to break it, and it's going to take some time. So as you go along, be willing to celebrate the small steps as opposed to expecting some instant coffee kind of fixing of the problems that you are going to have to face. Because sometimes the fact that we went through COVID-19 doesn't mean that now 2021 we will not have COVID-19 is still there, and it also doesn't guarantee that there will not be any other negative things that will come your way. There could be many. However, as long as you're doing your best, as long as you're doing your best to reorganize your business, even if it's not succeeding as fast as it would, to reorganize your relationship, you're talking to people and it's not working as well, give yourself time. It takes time to build relationships, to build businesses, and it's going to take time to make whatever COVID-19 destroy it. Be patient and take it one day at a time, as long as you're moving. Refuse to just be stuck because it's not moving as fast as you wish. Another important thing that we'd like to do as we go along, as we hope to, as we foster hope amongst ourselves, is to read other people's stories. Sometimes you feel like you are the most unlucky human being on earth just because your business didn't go as well. Remember, for most people, maybe you still have some salary, but it's business that didn't work as well. And you're only focusing on yourself and thinking you are very unfortunate, everyone seems to be doing well. And I've just learned to, and this is not to encourage mediocrity, but to look at the people behind us. It's true, there are very many people who are ahead of us and they're doing very well. But take time sometimes to read other people's stories of what they're going through, and you will be surprised at how much far ahead and how many people want to be in your shoes. You are worried that your matatu business collapsed, for example, and then you realize there are people who both spouses actually lost their job, and then their child was unable to progress, they have no school fees, and then their cow died, the one they could have sold to pay school fees. And when you listen to people's stories, you say, wow, I am actually very, very lucky. So other than looking at the people who are ahead of us, sometimes it also helps. And I'm not saying remain focused behind you so that you feel lazy or you feel like really you have to settle where you are. No, I'm saying work very, very hard, but try to also look at so many people who are not as privileged as you are. And this is through reading their stories or listening to other people's stories, and you realize how successful or how well you're doing despite how bad you feel at this point. The other important thing that would encourage us is to get involved in other people's lives. And sometimes, especially when you volunteer your time, whether it's to feed some charity or to whatever it is that some children's home, or to contribute to a church activity, or whatever it is that makes sense for you. Sometimes doing that and seeing other people appreciate. One of these days we were involved in, and we contributed very little money, and it's at a time of COVID, and you go around and you just buy a few packets of maize flour, and you find an old lady, and you realize how grateful you should be. And I'm not saying that you ignore the fact that you're going through suffering. And one of the ladies we found, I remember that week we had just been talking about shoes, and my husband kept saying, I don't remember you saying you have enough shoes, because there's always something, especially about us ladies. And there's always another shoe you need, or a shoe is fingering your toes, and you're always somehow complaining. And I find this lady who, you can't even imagine the last time she wore shoes. She didn't have dinner that evening. And when you bring the maize flour, I didn't hear what she said because it was in Kalenjin, but her tears flowed. And she was so grateful that finally someone brought her food. Volunteering in such things make you realize how really privileged you are. And we encourage that at this time, when you're thinking like you really are going through terrible times, difficult circumstances, it's very important sometimes to volunteer and get involved in other people's lives who are not as privileged. And I kept remembering, this lady just needs a pair of shoes that cost 300 bob or 400 bob, and she'd be so excited. Not what I'm talking about, oh, the color of the shoe is not as good as I wish it to be. So get involved in other people's life, volunteer your time so that you're not there just complaining all the time, you're getting active. And one other thing is that when you do that, when people appreciate you, really, it validates you, gives you purpose to keep living. So we are hoping that you can give other people messages of hope. And when you do that, you also give yourself a message of hope. The other important thing as we focus in the future is talk about it, share your challenges with someone. Sometimes when you're thinking about your problems alone, you feel like it is overwhelming. But sometimes when you share it, even just in the process of sharing with whoever, and I'm not saying share it on Facebook, it's great if you can share it on Facebook, but unfortunately, I don't find that a great resource in terms of hope, because sometimes you realize that the social media people really don't care too much about you, and you could be sharing your problem, and other people have worse problems. You get insults, and you get all forms of reaction, and it hurts you even some more. We encourage that whatever it is that you went through, and it's overwhelming, you share it with a trusted friend, one who will tell you, I got your back and I'm here to support you. Very, very important. Talk about it. Don't just keep it with yourself. And sometimes even when you're talking about it, you realize yourself, not the person you're talking to. Actually, you discover a solution. And it goes with the saying that when you share a problem, it is half. Half of that having is actually what you think through as you share. So let's encourage ourselves to share whatever it is that we are going through. Very, very important. Then as we think about this, we need to also focus. You know, some of us are so focused on the past and what happened that sometimes you miss when the new opportunities are opening up. It's good to say, okay, the past is gone. And there's nothing, even if the world stopped today, we can't return yesterday. It is gone and it's completely gone. There are mistakes that you made. That's okay. You're human and human beings make mistakes. There are things to say that you can't reverse. How do you learn from those mistakes? How do you learn from whatever you went through yesterday to make tomorrow and today, of course, better than yesterday? I think it's very, very important to not only, some of us are stuck in the past. So my husband lost a job and we spent all the time fighting, it will never be well. What about tomorrow? That is gone. Is there any hope for tomorrow? That will mostly be, you will develop that if you're able to say, okay, I am human, I made mistakes. It's okay, I went through whatever I went through, whether it's a loss, I am a better person. I want to focus on tomorrow so that you can see new doors opening. You're not just focusing on whatever is gone, which you really can't reverse. So it's very, very important that we remember that focusing hope for ourselves and for us as a team is so important for our mental, physical, and emotional well-being. And that if you remain in 2020 and the things that happen, most likely you're likely to be affected in many aspects. And we want to encourage us and our colleagues. You know, sometimes we focus on ourselves and we forget the people we interact with. Us, this hope is not for us as individuals. This hope is for you as a person, but it's also for you as a team. How are you helping your colleagues at work? And people are affected differently. How are you helping each other as a team of healthcare workers to say, okay, yesterday is gone. We need to look at the future and look at it hopefully so that we can enjoy life, so that we are not living dead, as it were. So I think that's what I'd like to say. A heart of gratitude, thinking positively, looking at the bigger picture, inspiring yourself with other people's messages, celebrating your own little successes, whatever they are, even if they're not celebrated on social media or in any other places. Remaining patient, meaning remembering that it takes time to rebuild whatever it is, whether it's relationship or finances, being involved in activities to help people who are behind you, talking about it with everyone, and focusing on the future and not the past. And above all, in case you have done all these things, it's very, very important to seek help. And I'm sure we'll be told shortly about, for us healthcare workers, this season, why are we here? We are here because we want to support each other. That's the whole purpose of this meeting. It's not purely academic. It's not to talk about what depression looks like. It's for us as a family to ask ourselves, how do we keep supporting each other despite the challenges that COVID brings, despite the challenges that the strike is bringing? Because that's the other thing that we may not have mentioned significantly, but it's affecting many people. There are many healthcare workers without a salary today. And while collectively it looks great, and there will hopefully will be a CPA and there'll be good outcomes, there are families that are suffering, because that is the only thing that you are paying some loan, the county has stopped your salary. How do you move on? So we want to we'll say as the team of the physician wellness team, the healthcare wellness team, we are here to support you, and later on you'll be given the details of how you can reach any of us so that we can support each other to make sure that as 2021 unfolds, we are leaving no one behind. No one is dying because they felt hopeless, because of the things that have happened in 2020 and the ones that continue to happen in 2021. Thank you very much. Back to you, Ohas.
Thank you so much, Dr. Kwoba. I am going to hand over the next part of the presentation to Cecilia Ndungu. But before I do so, please feel free to put your questions on our Q&A here and also on Facebook so that we are able to address the same. Cecilia, karibu sana.
Thank you so much, Dr. Josephine. And I believe Edith and Liz Haemba have greatly made a great impact and presentation. And 2020 is the year that healthcare workers have greatly been aggressive, and they have worked together as a team to come up with COVID vaccine. And this is a way, and this is a great way of showing that there is hope. There is need for hope for the healthcare workers, because we are all uniting together to look for a solution, to look for a hope, which will be able to give us a mental stability. Because when there's no something in vision, there'll be so much distress and psychological impact for the healthcare workers. And also, this is the year that also we have seen various stakeholders come together for the support of our healthcare workers. We have seen the various organizations, institutions giving support to the healthcare workers. We have seen some foundations funding, like Equity, funding projects for the healthcare workers. And we've also seen some industries giving out donations, PPEs. We have seen also some hotels providing food for the healthcare workers who are giving their services to the ailing, to have that morale, to have that, to feel appreciated, to feel that love that our services or whatever we are doing as healthcare workers is impactful, and it really makes a great change to the health of the whole healthcare system. And also we have seen challenging conditions, like the working conditions. We have had to modify or adapt to new ways of working. All these have created a perfect storm with the potential to seriously impact the healthcare workers' emotional and psychological well-being. And but we've been able to adapting to changes in this year, in last year that is, and moving forward to 2021, it has eased that tension, and it's a milestone for the healthcare workers. And also we've seen the global community come closer as a global village. We have seen various networks coming together via the virtual, that is the virtual platforms, whereby due to the travel bans, we've been able to hold meetings, to do the conferences, to learn from each other, share our experiences, and also learn. Actually, it's a great opportunity that we've had despite COVID. But on the other hand, as Edith has said, we have been able to look at the glass half full, not half empty, because it has had a positive impact. We are able to see people changing, transforming. And also this is also that last year we had various challenges which has taught us to be each other's keeper. When you see someone is ailing, when the government insist or tell us to take precautions like wearing the mask, washing our hands, sanitizing, we've been able to see that, appreciate that despite the drastic change, but we have been able to see that as not even as a mandatory, but as a way of protecting our families, protecting our loved ones. And this has really, I think this has really assisted greatly in eliminating some of the avoidable diseases, especially in children, and also staying safe. The unity that the healthcare workers and the citizens at large, it has created that hope. It has really irrigated to the hope, which is already growing, that we need each other. We need to support each other. When we have seen the various healthcare workers passing on due to COVID or other illnesses, we have been able to see people come together in bereavement. We've also supported each other in healing, various trying moments. We have been able to see that the healing process as a way of supporting each other and minding the welfare of each other. And also in terms of financial, the healthcare workers have really, what do I call this? It's a great conjoining moment whereby we saw some various people coming together for the various challenges, like the doctor in Machakos. We really saw that love, and it's a way of hope whereby if we come together, if we are united, the families affected, the communities affected, they're able to feel the love, the emotional distress they're able to come from that. And basically the mental illness and welfare is well taken care of if we unite together and if we mind each other, that is being each other's brothers and sisters keeper. And going forward, we have, it's a great way of embracing self-care. How am I going to, am I taking great care of myself in this time of COVID, in these unprecedented times whereby you don't know where or how you can acquire any illness? And it has been a great moment for us. And moving forward 2021, I would like to urge all of us to continue being each other's keeper, to embrace that peace and unity that we've had, and always watch out for warning signs for each other, because this way we'll be able to avoid various circumstances like losing one another, and keep advising each other and the community at large that we are here for everyone and we love each other, and that way we'll have a great and perfect year. Back to you, Dr. Ohas.
Thank you so much, Cecilia, for that very good talk. So we are going to move to our questions. We have 4 questions. I'll read them out aloud. Question 1, which will be answered by Dr. Liz Hayemba. Anonymous attendee asks, how do you manage denial by close members of staff or even spouses who are not able to adjust downwards financially? Dr. Hayemba?
This is not easy, because denial actually is a coping mechanism. It's not a very good coping mechanism. It's a bit primitive, but it is necessary. And some people actually use it in different ways. So how do we manage a family member who is unable to cope with reality and realize that maybe we need to just move downwards a little bit financially? I think approach is important, how you talk to them, because when you're not financially able to meet your needs, there's a lot of shame, and there's a lot of loss of face. Let me call it that way. And I believe how one talks to them, if you offer some sort of assistance, and you offer it in the right way, some people actually are willing to take it. But a conversation here is important, and it may be an uncomfortable conversation, but it is necessary. There is always hope, and this is the topic of today's webinar. In that, sometimes we need to go down to come back up again. And a lot of people have actually, that has happened to a lot of people. Sometimes you lose, I know a friend of mine who lost some money trying to buy a car, a better car for the family. And I mean, he was really broken for a while. He had already sold his car and was now using this. But sometimes words of encouragement, words of motivation, and sometimes even listening to other people's stories, like what I just said and what Dr. Koba spoke about, it helps, you know, to be able to know you're not alone, to be able to know sometimes we need to go down to come up. We need to ricochet back, you know, we need to hit a different area where we are not used to, where it's uncomfortable. We can encourage also these people to seek some spiritual support. You know, sometimes we need to go back to the spiritual, or to the Christian, or to prayer, even to just help us to cope with some very difficult decisions. If this is a family man, for example, or a family woman, we would need to encourage them to talk to the children, you know, and just explain the reality. Sometimes what happens in our heads, in our thoughts, is not really what is happening or what other people are thinking. And with children, for example, when you have to talk to them and tell them, okay, look, we probably need to change schools, or we need to change where we live, or we need to move towns. Sometimes they don't take it quite as bad as we imagine, or they don't feel as bad as we imagine. So just being able to talk to your family, to talk to the people who the change will directly affect, and being able to rope them in, so you're still together, you're still a loving family, and you're willing to face things together. That sometimes helps a lot. Also, it may be necessary to talk to a professional who can help just provide the correct coping skills for this, for whatever this person feels has befallen them. A lot of people cope well with change. It may not be positive change, but we kind of adjust, and some people just don't do it very well, and it may be actually a trigger for further or future mental health issues, which now at some point may need actually to be addressed by a professional. So we need to gauge, if you're the one who knows this person, you need to gauge, is it time maybe we bring in somebody else? if we bring in a professional who can then be able to guide this person, who can be able to provide the coping skills, the skills and strategies to give this bad news or to give this news to the rest of the family, who can help this person with self-concept and self-esteem issues that they may be going through at this particular point. So I think that's really what I can say, unless one of Dr. Koba maybe has something to add on to that. Thank you so much, Dr. Haas, for this.
Thank you, Dr. Liz Haemba. Dr. Koba, do you have anything to add on to that? Dr. Atwoli, sorry, Professor Atwoli?
I don't have anything specific to add, but I'd say, like we say, you talked about patience. Sometimes we need to be patient with them. It's complicated. We all have our egos and our prides, and it takes a lot of energy to accept things have changed. But constantly, supportively, but firmly reminding them that you can't continue living on castles in the air. You must be realistic about whatever is happening in life. But again, family and understanding that they're just not proud is that this is what the society has held them to be, and it's complicated sometimes to accept that suddenly you're going to change your status. And we've seen even such change in status sometimes has contributed even to things like suicide, because some people feel like I'd rather die than start going on a matatu or change a residency from whatever posh estate to another one. So it's not as easy. Support, but continuously remind them that it's okay. And probably the world doesn't care too much that you change your estate. And we will talk, it's true, but we talk and forget because we also have enough of our troubles. To Professor Lukoe.
Yeah, thank you. I hope my connection holds. But I think I'll just say one more thing. You guys have covered everything. What I would add is that you don't need to wait for a crisis for you to start wondering how you will deal with it. There are ways of inoculating yourself, especially with family and the people you live with, by having open channels of communication and discussing problematic things happening around you and how you are coping and how you are dealing with them. So that when a crisis comes and you have to change your status, then it is easy to discuss and everybody is open about it and everybody understands why the change is happening. So let's not wait for a crisis to happen. Let us have as open channels of communication as possible within our families so that when a crisis happens, we are available to support each other. Thank you.
Thank you. Jackie Arundo, anything to add?
Thank you very much, Dr. I think much has been said. I'd just like to add something small that indeed, sometimes you're encouraged when you know that you're not the only one going through what you're going through. Everyone has suffered in one way or another. But when you reach out to each other, pick your call someone, SMS someone, you'll find that you are able to solve whatever it is that you're going through. So I'm also happy that we have the call center that I believe you guys are going to talk about that can tell people that there is help out there. There is hope out there. And as Prof has said, we don't need to wait for another crisis. We don't need to wait for another pandemic. What happened has prepared us. And I think that moving forward, we are now better equipped to be able to walk through whatever it is that you're going to face. And we have each other to work with each other as we face these problems. Thank you so much.
Thank you, Jackie. So on to question number 2. We'll direct this to Dr. Koba. People are spending a lot of time on digital platforms. Please talk more about social media and perhaps the need for a media holiday. Social media can sometimes interfere with positive thoughts, and there's the question of an unreal aspect. Everyone looks so happy, and so one begins to think they have failed. Dr.
Thank you very much. And I agree with the person who has raised that concern. That is true. There's so much happening in social media. First, we don't want to say that social media is bad. There are good aspects of social media. You get to learn about news, there's new information, you can know how to do positive things. But on the other hand, if you spend so much time on social media, first, what was that time meant for? And we've noted that sometimes we're always thinking that we're in a crisis and we don't have time, but it's because the first thing that you do when you wake up is you start looking at WhatsApp and Facebook and Instagram, and before you know, 3 hours have been spent. So I think in terms of social media, it's important to be on social media for one reason, that you really need to change the time and know what is happening. But if you're there to see who is trending, who was checking into where, who is wearing what, and begin to feel bad about the fact that you're not doing as well, then it's harmful for you. And you need to ask yourself, why are you there? If your reason is to compare yourself negatively, then probably you should rethink about the need for it. Once you've established that it's important to be on social media for positive things, things that help you grow, things that inspire you. There are nice stories on social media about how people are doing, and you say, oh, wow, I can also do that. I can learn that skill. It's nice. I can improve my dressing like that. That's positive. Once you have confirmed that you're on social media for the right purposes and it is helping you, not killing you, then you need to ask yourself, how much time should you spend on social media? As a matter of fact, if you spend 5 hours, unless you are unemployed and you have nothing else to do, and I don't see the reason why you do that, because even if you're unemployed, you should still be doing something to sort of get your income. You have things to do. You need to tell yourself, you can only do social media at specific times to get that positive aspect. And we say it could be an hour, you can plan for an hour also, and we encourage that it's not at the beginning of the day. And as much as possible, it's not in the middle of important things, because what you realize is out of gossip and juicy stories that continue happening. And before you know, you are carried by the Bridgerton story, for example, and before you know, you want to hear this description of the Duke of Hastings, and before you know, you have missed on submitting the minutes that you should have spent, then you're frustrated. So we need to plan. I think maybe one of these findings we need to discuss about planning our time in our day, and you realize that you cannot afford to spend so much time on social media if really you have goals and you have priorities. So let's use social media positively to grow ourselves, not to harm ourselves. And remember, like you said actually correctly, a lot of people are acting on social media and they're showing you what you want to see. And if you keep thinking that everyone is doing better than me, you will be dead. Instead, focus and tell yourself you need to learn. Plan for it. How much time are you spending? Learn to put your mobile data off. A very, very important point, because unfortunately there are always all these updates. Put off your mobile data when not important. And if it's harming you, rethink and ask yourself, do you need it? You need all of them, for example. I think that's what I'd say. But I think Professor Lukoya would also have some wise words. I see him quite active on social media. He would definitely have some wisdom regarding social media.
Thank you, Edith. I think I look at social media the same way, and this has never changed. We had social media even in the Greek marketplaces. We had social media in traditional African societies. It's just that the social media was in person, but now we have taken it to a digital platform. So every time you're participating in social media phenomena or events, you should remember that it's the same as standing in a marketplace which is crowded. And in that marketplace, there might be rooms where you can go in, but those rooms still have many people. And anything you say or do is the same as if you're doing it in an open marketplace. And so I don't think anyone would want to spend their entire life in an open marketplace. There are times when you need to get home, get into a bedroom and be alone or be with the people that are close to you. So that should guide how you use social media. You have time when you want to go and see what's happening in the marketplace, and then you have time when you want to be away from the marketplace. So regulate how you use social media, and sometimes decide what you want to focus on. If you want to focus on a lot of positive things, then you will see a pattern. There are people who are negative, there are people who are positive, there are people who are uplifting. Then you can know that I'll be checking what so-and-so is saying, because they usually say very uplifting things, and I pick the uplifting message and I move on. But if you spend your entire day, your entire life at marketplace, it can be a pretty distressing place. Thanks.
Thank you so much, Prof. and Dr. Kuoba. So the third question, I'll direct it to Jackie and Nundo, and it says, how does one manage expectations from family because they feel you still have a government job and should support their needs?
Wow. Thank you very much, Dr. for that question. Yes, indeed, all of us, we have people that we are supporting. And as Dr. Koba said, we've been affected in one way or another. So I think it's important to be able to manage family expectations. It's important to be sincere with the family and tell them exactly what is happening, explain to them candidly what you are going through so that they don't have high expectations. Remember, during COVID, everybody has had to adjust and people who have even had to learn new skills in order to be able to put food on the table. So for me, I think it's important to manage family expectations and deal with those expectations in a very sincere way. Have a sincere talk with the family. Talk about the needs and the wants of your family. There are those you be able to provide, but there are those ones that are not necessary at the moment. So I think that is how I'd be able to deal with it.
Oh, thank you so much, Jackie. Now on to our last question. This will be directed to Prof. Lukoye. The industrial unrest in the health sector is weighing the health workers down. Without getting into the politics of it, please comment about coping skills for such challenging situations. Prof?
Thank you. Thank you very much, Josephine. I think that's a hard question, but I would treat it the same way I treat all problems that would come your way. And the first question you would ask yourself is this your problem as an individual? Is this a problem that is within your ability to resolve? If the answer is yes, then taking action towards resolving that problem is a useful coping mechanism. If the answer is no, it is not your individual problem to solve, you're not in charge of anything that would solve this problem, then worrying about it, thinking about it the whole day only accelerates your anxiety. During industrial action, as an individual worker, you didn't individually declare a strike. So to a large extent, it is a problem between whoever declared the strike and the employer. And once they resolve it, then maybe you get a benefit or you get a loss. But I would prepare for it in the sense that there is something that is to a small extent outside of my control, and the outcomes might be positive or negative, and I would prepare then to deal with whichever consequences come out of it. Obviously, it's better to prepare for the worst and hope for the best, and preparing for the worst includes imagining a life without that employment. It includes imagining a life where your circumstances become worse than they were before that industrial action began, and trying to take measures if you're able to deal with that. So remaining active, keeping on the move, thinking through alternatives is a useful coping mechanism in my view than continuing to worry about what will happen in government or with the employer, what will happen in the union and so on. At an individual level, it is important to focus on those things that you have the ability to change, those things that you have the ability to control, and then taking action to controlling them or changing them or improving them in order to improve your own circumstances. So that's how I would place even industrial action that worries you at your workplace. I would carry it as a problem that is affecting me the same way threatened job loss, the same way severe illness in a close family member would be, the same way any other calamity you may face. That if I have control over it, if I have the power to change it, then I will do whatever I can to change it. If I do not have the power to change it, no matter what I do, then I will focus on mitigation. I will focus on other things that will help me to survive whatever negative consequence can come out of it. Thank you. Josephine?
Thank you, Prof. So we have one last question that we'll redirect to Cecilia to answer it in less than a minute. The question is from an anonymous attendee. Mind opener, especially a time like January 2021. Oh, sorry. I think we've just lost the question. Sorry. So thank you, Prof. Thank you to our other panelists. Thank you to our presenters of the day. We are coming to the end of our webinar for the day. Thank you, of course, again to our participants for being patient with us. Just before we close, we would like to remind you all that the Thursday clinical webinars are resuming this coming Thursday, and the topic of discussion will be phylogenetics of COVID. Dr. Catherine Mutinda will be the speaker, and the moderator will be Dr. Simon Kigundu. So before we close, we are going to have Dr. Liz Haemba talk to us about our call center. So Peter, if you could kindly project the numbers of the call center.
Us.
Oh,
Hello.
sorry, Dr. Somba.
You have forgotten me. I've been waiting.
As Peter is projecting, we will have
sorry. Yeah.
Dr. Somba says something. Karibu, Daktari.
No, Asante, thank you very much, and good evening and happy new year, everyone. Yeah, I think today's webinar was wonderful, and I was thinking that we are going to be taught things like is usually the case, but I think it's all the way put, I think is very good. My comment, I'd like to say just a few things, if you don't mind. First of all, we give ourselves hope, and one of the things that before you overcome any enemy, you have to know the weakness. And I believe this time around, we know the weakness of this virus. And therefore, that gives us hope that we are already on the winning side. And if you look at the studies that we are getting every now and again, there are more recoveries than deaths. I think the figure now is about 90-something, and over 70 people have recovered. So I think that's a good sign that we are winning, that we know the weakness of this virus. And of course, then once we know weakness, then definitely now we can easily fight it and come out victorious. Something else I'd like to mention is that let us focus on the solution. You must have a goal of what you want to do. I think that sometimes that comes a big problem, that we just live without goals. Where do you want to go? When do you want to go? And what's the roadmap to that, to what you want to achieve? I think all of us should go back to those goals now, so that we don't just keep hanging and then we don't know what to do. But let's have a goal and the roadmap. And in addition to that, there's a very important thing that we must have, all of us, something called a mastermind group. You must have a mastermind group, a group that assists you, or you assist each other, a group of about 4 or 5 people that will be discussing your problems, so that, and you encourage each other, and then you focus on what you want to do. And that, I think, that can be able to really help us. Of course, we know we have the whole team, but a mastermind group has been known to be one of the most important things that can help people. You move as a group and identify a small group of people, mastermind group. So I'll encourage all health workers to be positive and hopeful. We know the enemy, we know the weakness of the enemy, and we are definitely going to win. And there are more recoveries than deaths anyway. And if you look at the statistics, even there are people dying in accidents than even COVID. So it's not a big thing anymore, and it's not a big worry. So let us be there, fight, and let us chase our dream, and love ourselves, as somebody was saying, and encourage ourselves. Thank you very much. Have a beautiful year and fruitful year, and let us continue with what we are doing, helping our patients without fear, because we know what to do with the enemy. Thank you very much, Johans, and good night.
Thank you very much, Daktari. Just before Dr. Haemba says something, Dr. Haemba talks about the toll-free line. Dr. Liz Gitau, would you want to say hi to everyone?
Oh, hi. Can you hear me, Ohas?
Yes, we can hear you.
Oh, so thank you very much for the very good presentations we've had from the various presenters, Cecilia, Liz Haemba, and Anundo. They've been very helpful in terms of starting the year. We've had a very difficult 2019. 2020. Sorry, I'm having a bit of feedback. So I'm grateful that we started the year with hope, and we know that in 2021, with the various mental health initiatives that we are having as the various associations, we shall be able to support the healthcare workers to have better mental health and to talk more about mental health, to create awareness and to have better health for our healthcare workers. Thank you.
Thank you so much, Dr. Liz Haemba. Kindly just close for us.
Okay, thank you, Dr. Haas. As Dr. Gitau has said, various associations have come together, and we came together and we wanted to find out what can we do for our medical workers, our healthcare workers, and we formed this call center. The call center is specifically for healthcare workers. Any healthcare worker, anybody who works in a healthcare setting, and their families are welcome to use these lines. Right now, our toll-free line, the 0800 number, is out of commission. We are working on getting it back up, but the 011-0098870 and 98871 numbers are working. You can call us and we will call you back. Should you call and you need a call back, all you just need to say is, please call me back. You could send us a text message, we will call you back. As I said, these numbers are for our healthcare workers. Should you feel you have any stressor, should you feel you have any issues that you need to discuss with somebody, something that is unsettling you, that is making you not in the mental space to continue with your work, should you find maybe family members who need to talk to us, or who you feel need to work through something and you are not the right person to talk to them, and these are members of your family or other members of other healthcare workers' families, please let them know, talk to them, and give them the numbers. They can call us, they can text us, and we will call back and work with you. So we know healthcare workers are usually a bit poor in seeking help, but we need to support each other at this time. Please do use the numbers, do call, and we are here for you. Thank you very much. So to conclude, I just want to thank all the panelists for this very, very timely presentation on hope for the year. Someone asked whether this is enough. We will continue having these webinars. We have the webinars every Tuesday, so please remember to log in and be a part of them. And at every webinar, we really try to give some education, but also be hopeful, bring hope to the group, to us as healthcare workers. So thank you once again. I wish you a fantastic year this year. Please keep safe, take care of yourself, take care of each other, and God bless. Good night to all.
Thank you, Dr. Good night. So we meet again next week on Tuesday. Bye-bye.
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 Bye, everyone.
Bye.
This one.